Pakistan, the colourful land of warm-hearted and resilient people, has recently undergone the aftermath of massive flooding and devastation caused by the heaviest rainfall during the last 2 consecutive years across Pakistan. The magnitude of last year's flooding was so huge that in the southern parts of Sindh province, thousands of towns and villages were simply washed away. Millions of people were displaced. Roads, buildings, bridges, schools, hospitals, crops and livestock were lost. UNFPA, as per its global mandate, immediately responded to this unprecedented humanitarian crisis in close collaboration and coordination with provincial and local district governments to address the urgent needs of nearly 5 million severely affected population in Sindh. UNFPA estimates that of this affected population, 193,000 are pregnant women, and of these, nearly 300 will deliver per day, requiring urgent emergency obstetric care services, as 45 women will daily face pregnancy-related complications and will needing referrals for emergency cesarean sections. In view of these staggering figures, the UNFPA swiftly engaged 50 mobile service units in far-flung areas of Sindh with provision of referrals for comprehensive emergency obstetric care for complicated cases. UNFPA rushed to revive these paralyzed health facilities in the most demanding circumstances and provided equipment, medicines, technical staff, both medical and paramedical, through partner NGOs to resume reproductive health services for the needy communities.
अभी थैंक्स गॉड जब से ये आए हुए हैं तो इस एक महीने में more than 300 डिलीवरीज हुई हैं और एंड more than 35 सिजेरियन हुए हैं. तो हमारी ये रिक्वेस्ट रहेगी कि अगर इसको ज़्यादा एक्सटेंड किया जाए तो यहाँ के आवाम के लिए बड़ा अच्छा रहेगा.
In doing so, UNFPA has managed to enhance provision of both basic and comprehensive emergency obstetric care services around the clock at these health facilities.
एंटीनेटल पेशेंट और पोस्टनेटल पेशेंट्स को बड़ी प्रॉब्लम होती थी कि वो एंटीनेटल के लिए कहाँ जाए, पोस्टनेटल के लिए कहाँ जाए. तो DHQ सांगड़ जो अब फंक्शनल हो गया है, हम अपनी एम्बुलेंसेस के थ्रू वहाँ पर रेफर भेजते हैं. इस तरह हम लोगों को पेशेंट का फीडबैक मिल रहा है कि पेशेंट यहाँ आ रहे हैं, सेटिस्फाई होके जा रहे हैं. तो हम चाहते हैं कि ये सेटअप कंटिन्यू रहे, ये अब खत्म ना हो.
During humanitarian crisis, the situation worsens and becomes more life-threatening for pregnant women, resulting in an increase of preterm deliveries of already malnourished and anemic mothers who face formidable challenges to access vital humanitarian reproductive health services.
Over the last 2 years, we have seen a continuous movement away from floods in 2010, and then we started on this early recovery. And as we were into the early recovery phase, then the monsoon struck. So it's a kind of a complete cycle of one disaster leading to another disaster with very little space in between.
Pakistan's Demographic Household Survey 2006 reveals that a high fertility rate of 4.3 has resulted in pregnancies that are too young, too old, too many and too frequent, translating into a maternity mortality ratio of 276 per 100,000 live births. This dismal picture is made more dangerous by the traditional birth attendants called dais, who conduct 61% deliveries at home. The increased risk of dying in childbirth is magnified many times over during humanitarian crisis. Ensuring that these vulnerable and traumatized women are delivered by skilled birth attendants remains the most serious challenge owing to the highly patriarchal cultural context of the country. UNFPA's partner NGOs had to counsel extensively the husband, parents and other relatives of the pregnant women to access vital reproductive health services. UNFPA also ensured swift distribution of essential reproductive health kits, including safe delivery kits, hygiene and newborn kits, to the affected communities.
छोकरे ॿुधायो त घर ठिकाई कोन्हे का न्याणी चा कोन्हे भॼंदो जीअं आहिस्ते हालत हिन जी मूं ॾिठी कंजारी में असां खणी वियासीं हुते जेको असांजो मसलो हल तरीक़े सां हुते कंडियारी में हल थियो असांजो ऐं असां शुक्रगुज़ार आहियूं पूरी टीम जा जो असांजो एतिरी मदद कई आहे असांजी हमदर्दी कई आहे असांजो हौसलो अफ़ज़ाई असांजो जेको असां इन में ख़ुशि आहियूं आऊं ॻोठ आई सभु मुंहिंजा भेण आया आहिनि भाइटिया साला न्याणा सभु ॻोठ आया त मुंहिंजा पंहिंजा अज़ीज़ आहिनि ऐं उन में वॾो आहियां सभु जीअं को मसलो आऊं सभु भुली करे अहिड़ो थींदो हाणे असांखे ख़बर पइजी बिल्कुलु असां हुते वठी करे पहुचूं.
It is equally important to maintain effective supply of quality medicine, equipment, hygiene kits, reproductive health kits, and other commodities, ensuring that no woman should die giving life due to pregnancy-related complications. The establishment of an efficient and effective logistical system includes steadfast procurement, warehousing, and speedy means of transportation. UNFPA's humanitarian response was strengthened through forging strategic partnerships with reputable organizations to deliver quality services to the most vulnerable segments of communities in Sindh.
We have been working together globally, but in Pakistan, starting from the last two emergencies, we have responded well. Remember, UNFPA provided us the technical skills, the materials, and with the global fundings available, we saved one life, and each and every life counts.
Continuation of these vital reproductive health services remains a daunting challenge. Joint concerted efforts with provincial and local governments, support from civil society organizations, and much needed donors' assistance is vital at this critical juncture.
हमारी tremendous results आपकी help की वजह से ही आए हैं. अगर आपने हेल्प नहीं किया लास्ट कमिंग 3-4 इयर्स के लिए तो जो चीज़ें हमने इस वक्त हाईलाइट की हुई हैं और लोगों को दिखाया हुआ है कंपेयर वो हमारी सारी की सारी सप्रेस हो जाएंगी.
The impact of life-saving humanitarian interventions initiated so far will prematurely fade away, putting so many more lives at higher risk and shattering people's confidence in the revitalized health system if these critical humanitarian services are abandoned at this stage.
Even during flood times, pregnant women have to deliver, and it's our responsibility to make sure that working with government, these women are able to deliver safely.
Pakistan, as the 6th most populous country in the world, is ranked the lowest at gender inequality related index. Pakistani society is structurally patriarchal. These structures maintain the subordination of women and girls, especially in rural areas. Consequently, women and girls are considered less competent and less worthy than boys and men, and their right to education, nutrition, health, physical safety are curtailed. The situation is further exacerbated, especially during conflicts and humanitarian crises, when these women and young girls are exposed to enhanced vulnerabilities resulting in physical, sexual, and psychological abuses that cut across lines of income, class, and culture. UNFPA has been leading the gender-based violence subcluster in the country, demonstrating its full commitment to address the GBV issues of displaced women and young girls during the humanitarian crisis. Though there is prevalence of GBV incidents during humanitarian crises such as physical and sexual violence, denial of resources, opportunities or services, psychological and emotional abuse, forced and early marriages, trafficking and abduction of women and girls, and harmful practices such as honor killings. Yet, there is marked underreporting due to which the number of cases are considered as underestimates.
जेंडर वायलेंस की एक्सट्रीम है तो उस पे हम लोगों को सबको काम करना है क्योंकि ये सोशल एक चेंज का मसला है वो अचानक नहीं आएगी.
Effectively respond to the needs of GBV survivors during the response relief activities, UNFPA, while advocating for preventative measures during the humanitarian crisis, UNFPA engaged many local and civil society organizations to conduct awareness-raising activities in the camps and established women-friendly spaces, including facilitated legal aid to the GBV survivors.